Some Iowans will die 20 years earlier than others who live just a short distance away because of differences in social and environmental determinants, such as education, income, race, ethnicity, and where they live. These Iowans die from preventable health problems, and their health is greatly influenced by these powerful social determinants. We must find ways to reverse the negative effects of these factors and enable more people to lead healthy lives and avoid getting sick in the first place. Social determinants of health are conditions under which people live and work that influence health and quality of life. They are societal risk conditions, rather than individual risk factors that either increase or decrease the risk of disease, such as type 2 diabetes. Another way to think about the social determinants of health is they are the conditions that are beyond the ability of an individual to impact on their own. In September 2015, Tyler Norris facilitated a staff retreat and planning session on social and environmental determinants of health.
So our conversation has been about what creates health. What are the drivers of health, the determinants of health, the contributors to health, and what undercuts people's ability to be healthy or to manage their chronic conditions. And we started off with a beginning of perhaps only 10% of what creates health has to do with access to medical care services. Another 30% has to do with our biological inheritance or our genetics. But fully 60% of what creates health has to do with our lifestyle and behaviors in the context of our environment. So what we eat, how much we move, our use of tobacco or our immoderate use of alcohol or other drugs, and how that's influenced by the socioeconomic and environmental factors in the community that either support healthier lifestyles or sort of challenge us having healthier lifestyles. How does access to healthy, affordable, fresh food, because people have the ability to actually physically get to a place or be able to afford that food, how is that impacting health or supporting somebody's ability to manage their diabetes or hypertension? The sense that their housing is adequate to not have the dust and the mold that might drive asthma. The way in which the neighborhood is safe enough, both has sidewalks and crossing and adequate lighting that parents would feel comfortable with their kids being physically active, walking to school, etc., walking to work. How much does the environment actually support physical activity so that we make sure we get our 30 minutes a day or 60 minutes a day for kids? And how much does the culture that we live in essentially support healthier lifestyles?
This is Ted Boesen, and I am the CEO of the Iowa Primary Care Association, and we are very excited to be on this journey with the Iowa Healthcare Collaborative and grateful for the SIM funding which is being directed to this work. We are also grateful to the Iowa Legislature for their 10 years of funding and support of the Iowa Safety Net Collaborative Network, one of the very few kinds in the country. This last year, the collaborative has focused on identifying the need for more work in the social determinants health space, and we are very excited that we're about that work. Social determinants of health is a great opportunity in Iowa. We are used to working together for change and can do so for the social determinants of health. We need to use the collaboration, hard work, and innovation Iowa is known for to address this challenge. We hope this project is the start of a more contemporary focus on improving care. Data can lead to improved, compassionate care and changes in payment and patient outcomes. We hope looking at social determinants of health in community programs more closely will be as valuable to the C3 communities and other stakeholders as it has been in the focus of the work of the Iowa PCA and the Safety Net Collaborative. We really do look forward to continuing this exciting partnership with the Iowa Healthcare Collaborative and the outcomes of this very exciting effort.
Well, I'm excited about this project in Iowa and addressing social determinants of health as part of healthcare systems transformation. Really, the health system has gone through transformations in the past from primarily dealing with disease and injuries and moving toward managing chronic health conditions and responding to those types of conditions to really now focusing on how we can improve health and how we can have strong health promotion and health prevention strategies. And I think that's where social determinants come in, because we know that high quality medical care plays a role in improving people's health and longevity, but the vast share of the factors that affect health and longevity are not medical care and treatment, but they're what are called social determinants of health. And that includes access to basic human services and needs, housing, transportation, food, clothing, but they also relate to the stresses that exist in one's life and the workplace settings that one's in, and how many social ties and connections one has, which also lead to lifestyle issues around involvement with drugs and addiction. So all of these relate to a person's health and longevity, these social determinants. And there is now, I think, really an emphasis on the healthcare system not responding in total to these, but being a good first responder and connecting individuals and families and kids up to the types of supports that they need. What I think is really emerging in the health world is both working with individuals and families which may have chronic health conditions or concerns, and providing something that goes beyond medical care and is a care coordination. So if that senior who has diabetes and has difficulty maintaining their regimen has some other care coordinator or supporter who helps them maintain their lifestyles, that can do a lot to reducing long-term healthcare costs, but maintaining a person's health. If a child has a major physical disability, that child needs medical care and treatment. But if there's also someone who can help that child and family navigate what is in the community and also help the child to be just a regular kid interacting with others, even though they may have a disability, that goes a long way to promoting health. So there's that work on the side of people who have conditions that otherwise could be major health costs and tend to be chronic, to maintain themselves better through some form of care coordination in the health system going beyond medical care. There's also health promotion and more preventive approaches, and particularly when it comes to kids, and particularly when it comes to young kids, you really can't talk about the health of a 2-year-old outside the context of, are they living in a safe, stable, and a supportive family? And if they are living in that safe, stable, and supported family, they're going to do pretty well and their health needs are going to be managed. If they're not, they're going to be subject to adverse childhood experiences and potentially types of stress and toxic stress that have huge ramifications on their future health. So really the focus with social determinants is to still say the medical practitioner has received all this training so that they know how to deal with those medical conditions, and they are needed for that expertise. But that's only really going to be effective in as much as the individual patient or family also has those other social ties and connections and ability to manage their world. And I think that the major hope, I think, with our health system in terms of managing costs is through improving the health of people so that they're less likely to have the chronic diseases that do end up taking up so many of our healthcare dollars. I think Iowa's made a commitment to being the healthiest state in the nation, and I think we have a lot of strengths upon which to build. We have a lot of exemplary practices in the field that really are responding more preventively and more comprehensively to individuals, and we're showing real gains there. I think our challenge is going to be in moving these exemplary practices to being the standard of practice and to building in the types of services that they provide or refer to that are non-medical into our thinking around what is a health system. And if we can do that, I am really confident we can be the healthiest state in the nation. And also, that leads to greater productivity, greater overall prosperity, and really helps to control the types of costs that we're otherwise going to experience because of debilitating health conditions.
In order to raise awareness and maximize access, podcast number 2 will feature programs and resources that address the social determinants and that are available throughout the state. First 5, Early Childhood Education and Development, SafeNet RX, Improved Access to Prescription Medications, USDA Rural Development, Financial Support for Critical Community Services, Food Bank of Iowa, Improving Access to Food for Food Insecure Iowans, and Iowa Area Agencies on Aging, Comprehensive Services for Aging Iowans and their caregivers. We know where people live is one of the most important determinants of health. For the context of these podcasts and webinars, we will be looking at 5 categories of social determinants of health. These categories come from Healthy People 2020 from the Federal Office of Disease Prevention and Health Promotion. Podcast number 3, Neighborhood and Built Environment, Quality of Housing, Crime and Violence, Environmental Conditions. Podcast number 4, Health and Health Care, Access to Care, including primary care and health literacy. Podcast number 5, Social and Community Context, Culturally and Linguistically Appropriate Services, Civic Participation, Discrimination, and Incarceration. Podcast number 6, Education, High School Graduation, Language and Literacy, Early Childhood Development. Podcast number 7, Economic Stability, including poverty, employment, food security, and housing stability.